Welcome to the GeoAI Podcast. I am privileged to be your host, Ajay Gupta. And I'm really excited about today's show. Of course, I'm excited about all the shows, but today is really something close to home for us, and I hope for many of you as well. Today, we're going to talk about the general topic, the broad topic of artificial intelligence in healthcare. And we're going to talk about it from the perspective of AI really being uncharted potential, right? AI's next frontier is healthcare, and healthcare can not only be uncharted potential for AI, but AI should be uncharted potential for healthcare. I say that in a lot of ways, and we're going to get into it with our guests in a second, but one of the things that we see in healthcare is that when we have a new pharmaceutical or a new medical device, we can always say the gain would be a certain function, a certain percentage, a certain capacity will be the gain from this new innovation of device, of treatment, of diagnosis, of pharmaceutical to healthcare. But with AI, we don't really know. It could be a 10x improvement, it could be 20x, it could be marginal improvements in some areas, but it could also be world-changing level of improvement that allows us to completely reimagine how care is delivered in the 21st and 22nd centuries. I'm excited to talk about this for many reasons, but of course it's what we do at HSR.health, and it's also what everyone is talking about. Even mainstream AI companies are starting to talk about their capacity to help healthcare. Let me introduce my guest who's here to talk to us about, join us in this conversation, Shrey Kapoor. And I'm really excited, Shrey, that you're here with us. Welcome to the GeoAI Podcast.
Thank you, Ajay. I really appreciate you having me on.
I think you've got a great background. You're going to bring an interesting perspective. And I say that because, and I want you to sort of walk through the thought process here, but you have a joint MD, MBA dual degree acceptance at Hopkins, for which you've received a full ride scholarship, if I'm not mistaken. But you've put that on hold to do a startup in the technology space in healthcare. Tell us a little bit about that, and tell us about yourself.
Yeah, absolutely. No, it's been such a privilege, being accepted and spending some time at Hopkins. I went there for undergrad as well, but my story starts a little bit earlier. I grew up in the San Francisco Bay Area, surrounded by technology my whole life. I think just being around such a hotbed of innovation, it trains you to think differently. And so when I set out on that pre-medical journey, it was to impact patients and to deliver care, truly. But along the way, when I entered medical school, I entered during the pandemic, and it was a really troubling time for many of us, as we all know. It was raging here in the US. It was particularly worse in India, where my extended family's from. And I lost my grandmother during that time. It was very difficult, just being someone with the only person in my entire family with any medical experience ever. And so taking a lot of ownership of her care, but trying to coordinate care was impossible. Hospitals were overcrowded, resources are limited. And it was very difficult. But what I did after that, I think, changed the trajectory of my life. And this is what I owe Hopkins a ton, because I recognized my position there. I put together a few medical students, and we had around 50 medical schools across the country created an initiative to really spearhead some global relief efforts. We put together around $5 million to send equipment, drugs, ventilators. We work with Boeing and UCLA to send those abroad to India. We petitioned the Biden administration to release vaccines that were stockpiled here in the US, not being used. I penned that letter. And then lastly, I started this rapid antigen testing program where we went door to door testing folks. Hopkins Resources did in India. And whenever folks tested positive, gave them access to oxygen and dexamethasone, things that were life-saving at the time. That impacted around 30,000 people, something that I scaled 0 to 1 at 23 years old. Never thought I would do anything better in my life, honestly. But the ability to touch and reach so many people with an initiative as large scale as that taught me couple things about myself. One, my place in the world wasn't going to be necessarily one-on-one clinical care. It was in these at-scale initiatives where I found myself thriving in those leadership roles. So that's when I decided to go get the MBA from Hopkins. But funnily enough, no one had ever done that before. No medical student had actually gone to the administration and said, can I do a dual degree? And I think that says a few things about how healthcare in this country is structured, and how limited some of those people are that can think about things in multiple different ways. But I think that trend is changing, and that's what I'm excited about. I'm excited to chat with you here today, how we can sort of leverage technology, specifically automation and AI, to solve for those same care coordination hurdles that have obviously plagued my family, but it's a global problem. And so now I'm the founder and CEO of MedSetGo. It's an AI company that's building in healthcare. So excited to share what we've learned so far and what we can learn together.
Absolutely. And I definitely want to get into MedSetGo and the care coordination component, or the challenge of care coordination in healthcare, as you mentioned, not just in America, but India and anywhere in the world. It's just a complicated thing. But I definitely want to pick on something you said that was not necessarily related to AI or healthcare, but is certainly present and is part of the challenge we face. That a lot of people simply don't do multiple different things. I think that is absolutely true, right? Even though we think of ourselves as highly evolved creatures, and maybe relative to the animal kingdom we are, but we are still creatures that are, to an extent, one-tracked. We're typically good at one thing, and we really don't do both things. So Johns Hopkins is a well-known medical school, maybe the best, and they have had no students before yourself want to do both an MBA and MD. Maybe that's not that unusual, right? That might be the norm. And I say how that's relevant to this conversation because in healthcare, it's not that we have a problem with individual things like diagnosis. We do have individuals that are very skilled at diagnosis. We have specialists that are very skilled at treating really even rare life-threatening diseases. But we don't have people that can do a little bit of a lot of things across the entire what we call care coordination or care spectrum, from preventive care through early diagnosis, through treatment, through chronic treatment, through maybe end of life kind of care, handling the whole chain in between. That's not something that the healthcare system is designed to address, and comes back to the fact that there's not that many of us that really see a problem from multiple perspectives and have the skill to tackle it. So
yeah, I'm a big believer in empowering physicians to think about their patients and outside of just the clinical setting, because so much of patient care is what happens outside of the hospital.
yeah.
And that's things like policy decision making. That's things like AI and technology and the way it infiltrates our healthcare system. It's how we think about the business incentives for when patients can sometimes be left without care because they don't have the right insurance.
Right.
All of these things matter. And if you think about things in a very real world, practical way, then I think we can sort of improve or move the needle on what is a very backwards healthcare system, frankly. And we all need to be a part of that change to make that happen.
Yes, you're right that the healthcare system is backwards. And I think it has always been that way, right? It hasn't really been causing a problem. It's been reactive, right? Maybe backwards is harsh, but healthcare is reactive. Once a healthy person gets sick, the healthcare system knows what to do. But if the healthy person is not sick, we kind of don't know really how to what even to start. Where would we even start with that? And that's a problem. It's turning out to be a scenario now where there are just too many people that are sick and need something, and we can't allocate the necessary resources to treat them all. So tell us about MedSetGo, and then let's get into how we think potentially artificial intelligence is a technology that offers the promise, really, of helping us to improve healthcare.
Absolutely. So healthcare does not stop at the hospital, and patients have hundreds of different needs once they're discharged. And yet case managers at hospitals and staff are overburdened with trying to coordinate this care for their patients that are leaving. What MedSetGo does is it's a very simple referral management platform. Think Amazon or Uber-like experience in terms of booking services for patients as they're leaving. but with a very 2025 approach. Number one, focus on interoperability. We don't want to be using the fax machine or even e-fax solutions to send referrals. We want systems to be connected and integrated so that when patients are leaving, the next person who's taking care of the patient is not starting from scratch, but providing care as a continuation of that care. And once they provide care, outside in the community, we want to be able to track all of that information and understand when the patient does come back to the hospital, why did they come back? And so having all of the different stakeholders in the community connected to the hospital system is the foundation for our care coordination platform. And on top of that, we want to build the AI suite of solutions. So whether that's searching and summarizing patient records, legacy EMR systems can build that for their own hospital systems. Mm-hmm. But that's only 10% of the data. AI models are only as good as the data that they're trained on. And so when MedSetGo solutions come in and connect the hospital records and the physical therapy records and the nursing home records and the home healthcare records, you create a unified patient chart and unified patient experience upon which you build the AI models custom to your localized hospital systems, which I believe is the future.
Right. So that's a lot there. Let's unpack that, because I think that's at least the right way the future, a lot of people think the future has to go. One of the reasons those nursing homes and hospitals and providers aren't connected today is because one reason is, I'm not suggesting it's the only reason. One reason is that they don't have a business relationship with each other today. So there really isn't, from their perspective, an incentive for that nursing home to connect their data to providers in the community, to hospitals, et cetera, all throughout the various locations of care. They're different businesses. They're operated differently. How do you address that? Or how do you suggest the business side of healthcare can be potentially changed to enable a positive incentive for different entities to share their data?
Great question. I think the biggest unsolved problem in healthcare isn't just access, it's fragmented information, where a single patient's story is split across EMRs, across systems, across care settings. Mm-hmm. And so when you bridge that gap with the patient's story, when that patient's story comes together, then we're able to provide better care. And as billing environments shift towards value-based, as there is a greater emphasis on patient quality and the quality of care that we're providing, everyone involved in this process needs to have access to the data, needs to know how to use it, and needs to be able to provide intelligent care afterwards. The second component to it is folks in the entire medical community are dependent on hospital systems for referrals. The reason why a service partner, as we call them, a home health or a nursing home, would want to be a part of our platform is the same reason why a restaurant joins Grubhub. It's access to consumers or patients. For them is business, right? If you boil it down simply. But for them to access that business, they need to share their information so that we can provide better care. So that's the partnership model that we're seeing. We want to help these nursing homes and home healthcare companies and PT offices and so on and so forth have access to pre-qualified referrals where they're matched by insurance, matched by zip code. So they're not getting phone calls left and right about patients they can't take. Once they get those patients, now this is business for them. So that helps their bottom line. But at the end of the day, they're providing better care. So they're not bouncing back to the hospital, lowering the readmission risk. And then the hospitals obviously get the benefit of getting their patients discharged quicker. So that decreases the length of stay. And we all know how expensive and costly it is for patients to stay in the hospital, not to mention the hospital-acquired infections and things that. So that's the way we're aligning the incentives between the hospital system and the partners in the community to really work together where everyone benefits.
So a broad Grubhub model where, as you point out, restaurants join Grubhub and the competitors because that provides an access to customers. Customers, especially during COVID, weren't coming into a restaurant, but they were using delivery services. So now the restaurant can take orders through Grubhub and these services and meet the needs of more customers. Yes, that works. Now in healthcare, I suppose a restaurant is limited to the throughput capacity of its kitchen and and cooking staff and kitchen staff. A lot of these resources in healthcare are tapped out today, right? That they really don't have the capacity for additional patients. Are you seeing that? Is that also discouraging involvement with a data sharing model like MedSetGo?
Absolutely. I think that's a capacity for taking care of patients after discharge is a critical problem across the country. There is infrastructure for it, but it's fragmented. And I think the way we're thinking about it at MedSetGo is that when you add technology to this experience, you can unlock different inefficiencies that were holding that same system back. We are not here saying we're going to boil the ocean and somehow there's going to be a bed available at every SNF for home health. What we are saying is that if you can give advance notice to those home health companies, for example, then they employ caregivers on part-time models. They can arrange for caregivers to be available at those specific times, right? And so that allows patients to be discharged faster and sooner. If the patient is matched by insurance using technology, the back and forth that's wasted for a patient who is potentially holding a bed, that goes away. So now there's a bed available for a patient as well in that way. And lastly, if you have an integrated model where data and availability and scheduling is actually legitimately shared with everybody, that creates a community-wide bed board, which now affords a visibility into for the hospital systems to also then be smarter with the way they're managing their patients and discharging their patients. So yes, is it going to solve the problem completely? No. But can we use technology to make those inefficiencies go away so that we can at least, especially given the critical nature of the infrastructure and capacity management issues, I think this is an absolute must that we use technology to get any benefit we can.
Right, sure. Even if it's a 10% increase in the patients that are seen successfully in the healthcare system, that could have a compounding effect, right? Then really reducing the backlog. Now, you mentioned a lot of players in healthcare, right? When we talk about beds, though, there's another player, two more especially. Let's one at a time. There's another player that has a role. That's regulators. Regulators, to an extent, not in every state or every health system everywhere, but in a lot of places, they do control or have outsized influence on the number of beds available, right? Is there a role in this broad visibility, as you mentioned, community bed board? Is there a role for the regulators to play in having the visibility into what healthcare is actually available for the people that are subject to their the patients that are ultimately subject to their regulations?
Absolutely. So I have a little story about this, and I think this will also encompass some topics related to AI. So Nevada, there's currently a bill on the Nevada legislative floor, Senate Bill 250, around patients owning their data. And I think that's incredibly relevant because, so I was called in as an expert to testify as a proponent of the bill because of my experience with what I'm seeing with MedSetGo, which is there is no incentive, as you astutely mentioned, for anyone to share their data unless there's a financial incentive or a legal requirement to do so. There's only two reasons. And so companies like us can create all the financial incentives we want, but there has to be a legal push to make that happen. And so TEFCA and some of the other regulations that allowed for better interoperability with the way different EMRs communicate with each other have allowed companies like us in 2025 to finally bridge the gap between different legacy medical record systems and actually create that unified patient platforms. Now we have to take that a step further, which is in AI, there are three things that will determine the value that AI can unlock: the models, the computing power, and the IP. Models are becoming better and better every day with large companies, Google, OpenAI, and others, they're moving that needle. Compute is NVIDIA and other companies, and we are on a track to really exponentially increase our computing power.
Yep.
So what matters now is for companies like us or anyone else in the community to really take a look at the data and the IP that the models will be trained on. And so in a world where there is regulatory approval and oversight that encourages data sharing, that encourages patients to own their data and verifiable data, now you can build the AI front ends so that users case managers at hospitals or patients can leverage the power of AI to unlock those inefficiencies that we were just talking about. But it has to be with the mindset in mind that the data and the IP needs to be as robust as possible. And I think that's where the regulatory piece comes in and becomes relevant for companies, especially like MedSetGo, who's trying to bridge the gap between such a fragmented ecosystem in healthcare, where I think if health systems, particularly key decision makers like healthcare system CEOs, payer CEOs, they really need to have some form of strategy for their hospital systems in AI in 2025. I think if you don't have a strategy in this day and age, you're doing it wrong. Maybe your strategy is not to use it, but you have to have a strategy in the first place. And I think that needs to be also coming from the top of these large health systems to say, what are we going to do about it?
Yeah, we definitely need to have an AI strategy. Definitely. So as a chair of a health system board, we have to have an AI strategy. I've been saying now, not just in 2025, but even as several years ago, that either we have an AI strategy and actively pursue the deployment of AI in all aspects of healthcare, both clinical and operational, or we will be forced to adopt what others have perfected for them. And then, we have to necessarily change our operations to accommodate that. Those are really the only two options. I think that there's a lot of people who are still naysayers on AI, but those, how's the saying go? The horse has left the barn, right? It's, or the train has left the station, or one of those things. We have to adopt this new way of operational computations, and the faster, the better. Not because every AI experience in healthcare will work, but that's just where the direction is going, right? And you're essentially saying scheduling, which is not necessarily an artificial intelligent algorithm, but the data that's generated would train the next level of artificial intelligent algorithms and models that are built. And so everything we're doing today is either directly AI or informing AI of the future.
That's correct. And I think hospitals need to run controlled real world experiments with AI. Think of it like a clinical trial, but for operational change.
That's correct.
That is the future. And AI isn't a magic wand. It's a microscope where it helps us understand patterns, but only if we know what we're looking for. So that's where I think the hospital health system CEOs, payer CEOs, and all the key decision makers in healthcare across the entire landscape, they need to really look at their specific hospital systems and understand how they're going to bridge the gap in data and IP, and also what solutions they're going to build in different, I'd say start with the safest, easiest to impact workflows: care coordination, triage, prior auth, discharge planning. These are things where AI can come in, solve significant problems, save significant amounts of money, and make actual impact to patient care at a very low cost. And I think these are the different areas that health system CEOs and otherwise should be really thinking about in terms of where they point their needle.
So you mentioned solving problems at low cost, which gets to the topic of ROI and the return. And I want to hit on that. But before we get to that, we have to acknowledge that healthcare is an industry, because of its risk level, that it is slow to adopt technology from outside the industry. And I think that's a distinction, right? Healthcare is not really slow to adopt medical technology, because diagnostic procedures, surgical procedures, medical devices do advance at a fairly good pace over time. But information technology and non-medical technology into healthcare has been slow because of the risk level and for a number of other factors. So what's changing here, or what yet needs to change for this level of innovation of information technology into healthcare to be at a faster pace than everything else that's come before AI?
That's a great point. I've been talking to hospitals and health systems, clinics around an appetite for a solution like MedSetGo, and I have not seen anything like it, like I've seen this year. I think there has been a dramatic shift in the appetite and interest for folks at the leadership level to really take a strong look at what they can do with information technology in healthcare. I think the reason for that is that AI is becoming so democratized and it's being available to the consumer in so many different ways that I believe patients today expect real-time updates or personalized care or seamless experiences, just like they get from Amazon or Uber. And so when the patients themselves are coming in and saying, hey, we want access, transparency, communication, it's very hard for leaders in healthcare to turn a blind eye and say, no, we're going to go a different direction. So I think that part of that is patient-driven.
It's beautiful. That's beautiful. Whatever it takes to get us to do that, but is important. And I, one of the big topics in healthcare, as you know, is ambient listening, where some device is listening to the patient-doctor interaction and doing the notes, the coding, maybe even some places the billing out of that conversation, right? And there's a lot of issues on the hospital side, but patients can just walk in and record a conversation right on their iPhone, right? Because the technology is available, as you said, to the consumer level, and not necessarily for coding or billing or anything that sophisticated. They just want to know what the doctor told them to do. They can play it again later. So I definitely think that this is a good sign for healthcare, that they're sort of being dragged forward by the patient population as well, because that's hard for everyone to ignore the patient. But now you mentioned solving problems at cost-effective measures. Technology we invest in technology because of the goal of getting an outsized return, right? I mean, a hot tech startup can go from zero to a unicorn in no time, right? And I'm sure, coming from California, you probably have a lot of stories of companies that have done just that. If this is true, where do healthcare providers fall in that category? Or I guess I'm sort of saying, do hospitals have a chance to benefit from some of that equity gain at all?
Yes, absolutely. So we are at a time where there is going to be an explosion of brilliant companies that are replacing antiquated workflows. Healthcare as an industry is, I believe, ripe for that change. So to the extent that hospitals and health systems build solutions that solve their own problems, generate a financial return where the solutions themselves are paying for themselves, and then also get in on the equity and valuation increases from the companies that they're investing in, is a no-brainer, in my opinion, especially at this time. So we've seen Gen AI cut documentation times by 70%. And there's companies that have gone on to raise hundreds of millions of dollars. That's not a marginal gain. That's an entire system unlock for these hospital systems. And in the same areas that I was mentioning earlier, you think of language exchange and prior auth and care coordination and so on and so forth. I don't think 100x in terms of efficiency is hyperbole. We don't know whether it'll be 10x or 20x or 100x in terms of the return, but we do know this is going to help. But I don't think it's hyperbole to say that the magnitude of this impact is going to be something we haven't seen before, because it's a multiplier on the time saved, on the burnout reduced, on the throughput improved, on the patient satisfaction that's gained. I mean, these are the ways where it's going to add up and impact all the different ways that your hospital system is either losing money or you're operating on razor-thin margins, and that you absolutely need to look at some cost-cutting solutions. And then obviously a solution like MedSetGo can come in, which not only improves length of stay and readmission rates and all of that, but once you connect all of the data in your community together, now you can use that in different ways to provide better quality care, to justify claims to payers. I mean, a solution like ours, for example, has already seen a valuation increase of 3x over the past year. We expect another 3x increase this year. And this is totally the norm. I know tens or hundreds of companies that are at our stage that are developing very niche, important solutions for health systems, where if they want to participate in equity rounds, they stand to gain significant sums of money from such an experience.
Yeah. And are you finding that hospitals and tech companies are making that relationship, that there is an equity relationship involved with piloting new solutions?
I think the most advanced health systems that we're seeing have venture arms or innovation arms. And so those are obviously traditional ones that are big players in this space continue to do that. But I think the dynamic is shifting where health systems where you maybe necessarily wouldn't think of those as a big focus on innovation of yesterday are focusing on that today. And want to get involved in the equity bumps and the valuation bumps that comes from the companies like ours coming into the picture.
Yeah, that is it's important. And you're right that when you think about it, some of the funding that is being talked about given to technology firms or infrastructure firms, in chip makers like NVIDIA, some of those funds are larger than the annual assets of a health system at all, right? Or the overall assets of a health system. So yes, the potential to unlock resources to pay for patient care is substantial. That's now, of course, that's the dream. Now, making it happen, there's a lot of steps involved in making sure that can happen.
Absolutely, and I don't think AI will fix healthcare entirely either, right? But I do think if we stop asking if it'll work, but start thinking about how it can,
how it'll work.
I think that mindset, I think, is how we make it actually work for clinicians and patients.
Right. I do think that AI is not, or no technology, nothing could solve every single one of the problems we know of in today's healthcare system. But I will say that what we currently see, and we say under the banner of artificial intelligence, I mean, we talked a little bit about generative AI in the context of ambient listening, but even generative AI in the context of asking an AI a question about operational issues so that can come back to a manager in very close, very short real time, all the way through machine learning for diagnostics like in radiology or other areas. I think it can change healthcare so much that some of the problems go away, that they're not encountered. Clearly, the rise in chronic disease that can be tied back to lifestyle and diet is not something that artificial intelligence can address, because we have to change our lifestyles and diet, right? Or we have to have more consciously take on preventive measures. But AI can help with compliance post-discharge. Post-discharge and compliance instructions is something that a better way to track a person having taken their medication at the right time could help alleviate some of those problems. Now, all of this presumes that the models we develop do have the right, good collection of sound data to train on. And we started at early on in this podcast about siloed data. How do you see MedSetGo or any other solutions in healthcare really getting, solving the siloed data problem?
Yeah, absolutely. AI can't unlock value until we unlock the data first in healthcare. Everyone, the different medical records, whether it's Epic or Cerner or Dr. Kronos or whoever else on the hospital side, and then the slew of different medical record systems in the community, they need to be together. And that's the approach that MedSetGo is taking to care coordination, which is you can't train smart algorithms on dumb infrastructure. You need everyone to be involved. You need everyone, stakeholders from a health system standpoint, but also the medical record systems and the data piece to be connected. And once that's connected, then you can know, where do I need to send a patient out? When the patient's sent out, am I matching them intelligently? Am I tracking what's happening with them? And when I'm searching, summarizing, doing all the beautiful things that Gen AI allows us to do now, can I search when was Daniel's last stroke from the hospital system's EMR, but also search, did they get physical therapy for it when they went home? I need to have a complete picture before Gen AI can solve any problem in healthcare. And so that's where I encourage and implore health systems to really think about solutions, whether it's MedSetGo or otherwise, who can come into your health system, look at your specific health system's demographics, connect the right medical record players in the community into one, and then we would build the AI tools for you to unlock all of your different challenges, whether it's prior auth or care coordination or otherwise.
Have you looked at any of these state health information exchanges that are attempting to bring different sources of data, health data together into one place? Are they trying to do the same kind of solution that trying to build the same kind of solution that you're talking about?
Yeah, so I've interfaced with HIEs as a medical student, searching for medical records for a patient. And honestly, the idea of it is fantastic. And it definitely helps because so many of the medical records are in the community. But the issue with that, the health information exchanges are they're opt-in for many states. They're a static repository, and they're not as clinically useful as we may think. And so we definitely need to lean on them because they've built that infrastructure. It's partial, it's not complete. It's also fragmented across state lines and so on and so forth. But I think if we build the dynamic tools on top of that static infrastructure, where we can leverage that HIE data, but also hospital specific data and community data that, for example, home health and SNFs, those aren't necessarily on those health information exchanges, right? Nor is the remote patient monitoring data for patients that are sitting at home. So we need to use all of these things to bridge that gap, of course, but it needs to be a holistic solution where everyone's bought in together.
Yeah. The HIEs did come out with a lot of fanfare, and it'd be interesting to see sort of where those organizations are thinking about how AI can advance them, right?
They'll play a key role.
Yeah, that's good to hear. Because a lot of money was invested in putting those together, right? So it'd be great to get a return on that. Even 10x would be fantastic. Well, I want to thank you for your time today, and tell us again what MedSetGo is, and what's your current challenge, and where you see your future.
Absolutely. So MedSetGo is an AI care coordination platform that connects you as a hospital system to the records of your community. And our biggest challenge today is we have a huge waiting list of hospital systems that are wanting solutions like ours. We just closed a big funding round. And so you'll be hearing about that soon. Now the goal is to operationalize it and to really help case management and staff get used to using AI tools, where instead of using a fax machine or an older, antiquated form of e-faxes, which some of our competitors use, training them to use digital AI first solutions like MedSetGo. So instead of going through the hundreds or 10-click process of booking a referral, typing in MedSetGo, I want physical therapy for Ajay Gupta starting tomorrow. Things like that is going to be a little bit of a shift as to how they've been doing things, but it's going to make their life so much easier. So it's part of that. That's our biggest struggle today. But honestly, it's a very exciting problem to have. And so we're pretty excited about our growth, and would love for you to, as a listener, to reach out to me. I'm readily available on LinkedIn, Shrey Kapoor, and my email address is kapshrey, SHREY at medsetgo.com. So please reach out, and I'm happy to chat further.
Absolutely. And it's interesting that you dropped in your funding round successfully closing at the end of the show. You didn't lead with that. That's great. Congratulations. That's fantastic news. And we certainly would be excited to get the press release when you're ready to announce it, and we'll share it with our audience, as we'll share your contact information, LinkedIn and email as well. Thank you again for joining and for having this conversation, pretty broad conversation on AI. We talked about everything from the data sources to potential user communities, including obviously everyone in healthcare, and for the benefit of the patients as well as regulators. You mentioned payers a couple of times as well. Obviously, if healthcare costs less, the payers benefit, right? They are paying for those costs. That would be good for all involved. And we look forward to hearing about your growth and future successes. Thank you. Thank you for joining us.
Thank you so much. Thank you so much for having me on, Ajay. It's truly been a pleasure to just chat about all the different ways we can benefit healthcare. There's so many, and it's only when I think people come together with different backgrounds and mindsets with the mindset of how can we solve these problems, will something even happen. So pretty excited about this conversation, and hope we have many more.
Absolutely. And I thank the rest of the audience for coming and for listening. And we look forward to seeing you again on the next episode of the GeoAI podcast. Thanks. This has been your host, Ajay Gupta. For Shrey Kapoor and Paul Churchyard in the background, have a great week, everyone.